Hello, good morning. I'm Dr. Hashmi. I'm just a psychiatrist, and you are watching my YouTube channel, Dr. Hashmi Online. It's all about mental health. This video is about the care homes. We have several types of care homes in the country, but most commonly we come across the care home when our loved one needs help. So the care for the elderly, those are the care homes which we need the most. And a lot of times we miss small things when we are choosing a care home for our loved ones. This video is all about things you need to keep in mind when you are choosing any care home for your loved one, mainly or primarily the care homes which are meant to provide care to our elderly, our parents, grandparents. Now, the first thing you need to look at is the location, whether the care home is located in the right place and have enough parking spaces, because you will be going there very often, and if the parking is an issue and location is an issue, you will have a problem. Then you need to look at the building. Now, a lot of care homes, they are not purpose-built, and they are located in the old style buildings. If it's a Victorian building, that's fine because they are very spacious. But a lot of times the care homes are built in 2-3 terraced properties, and they are very narrow with the corridors, and the movement spaces in the in the corridors, and the care home is very limited. Now, I have come across problems when somebody is taken into hospital, and when you are elderly, it's not unusual that you need hospital admission now and again. And the movement of an elderly within the care home must be easy and comfortable. Care home must be spacious enough to mobilize either a wheelchair or a stretcher without any inconvenience. That is a must. Then you come on the staffing. Now, look at the proportion of the percentage and proportion of permanent staff in the care home, because good care homes retain their staff, and you will see staff being there for a long time. You need to look at the proportion of the male and female staff members, because sometimes individuals with dementia and in their elderly years, they sometimes develop some kind of thoughts and fears, and they could be quite gender specific. Then in elderly, it is not uncommon that they don't like to be washed and cleaned and personal care to be provided by someone of opposite gender, which is common in men and women, which I have seen many times, that they are so reluctant for someone with opposite gender to start providing them personal care. So the proportion of male and female staff members on any shift is important. Then look at the night staff, the proportion of the night. Is the care home fully staffed during the nights? And what is the proportion of the gender among staff at night shifts? Then you need to look at the values of the staff, why they are in that profession, why they are in caring discipline. You don't want to leave your elderly in a care home where staff or some of the staff members are only working there because they couldn't find any other job. So the heart would not be there. So spend some time in the care home. Look at the environment. Look at the cues. Then coming back on the inside setting and the decoration of the care home. Now in elderly years, our senses are weak, our vision gets weak, so the floors, the walls got to be clean, tidy, with bland colors. We don't want too many things. Like I have been to many care homes in the country, across the country actually, and hundreds of them probably, because I practice mental health act. Hence my travels can be quite a lot in visiting different care homes, and sometimes the floors are not picked, the right floors are not picked, and the elderly, when walking on those floors, their perception is just get muddled up and mixed. It increases the risk of falls. So you need to look at for all those things. Then look at other residents. Look at the level of cleanliness. Look at the level of smell in certain parts of the care home. Because a well looked after resident in a care home should not smell of anything. They should smell nice. The care home needs to smell nice. The decoration needs to be right. Then you need to look at the way they have displayed their information. It got to be clear, concise, in a bold, large letters so that they can understand. Some care homes uses color-coded corridors. Some care homes use quite a large numbers on the doors for the residents to recognize them. All these things needs to be looked at before you decide to use that care home to look after your elderly. These are the basic things which I have mentioned. There are a lot more, but go for your instincts, not go for the closest one from your home, because the closest from your home might not be the best to look after your elderly, your loved one. And spend time with the staff, spend time with, just by sitting in the care home to get the vibes of it, and go for what comes in your heart. If your heart feels right, go for that. But look for the practical things which I have mentioned in this video, and I hope you find this video useful. Please prescribe to my channel, Dr. Hashmi Online, and we will let you know whenever the new video is uploaded. Thank you very much. Bye-bye.